Physical disabilities are limitations on a person's physical functioning, mobility, dexterity, or stamina. Many causes and conditions can impair mobility and movement. The inability to use legs, arms, or the body trunk effectively because of paralysis, stiffness, pain, or other impairments is common. It may be the result of birth defects, disease, age, or accidents. These disabilities may change from day to day. They may also contribute to other disabilities such as impaired speech, memory loss, short stature, and hearing loss.
The two general categories of physical disabilities are orthopedic impairments and neuromotor impairments. Orthopedic impairments are directly related to the skeletal system. Neuromotor is an abnormal performance caused by a dysfunction of the brain, spinal cord, and nerves, thereby creating transmission of improper instructions, uncontrolled bursts of feedback to the brain. Some types are seizure disorders, cerebral palsy, and spina bifida.
IDEA also provides special education services for students with other health impairments. These include the medically fragile, which are children at risk for medical emergencies on a regular basis and may also have progressive diseases, those who are technologically dependent and require life support or specialized support systems such as a ventilator, and those with traumatic brain injuries.
The chronic health condition students are most likely to experience in the classroom is asthma, which is a persistent inflammation of air passages that causes episodes of difficulty in breathing. As a classroom teacher, you will want to learn what triggers an asthma attack, like exercise, chalk dust, or carpet, any dietary restrictions, so that you can limit their exposure, as well as procedures to follow if an episode occurs.
Cerebral palsy is caused by damage to the brain before or during birth. Degree of severity varies and is often evidenced by lack of coordination, speech disorders, motor problems, and extreme weakness. They have problems with learning, vision, hearing, cognitive functioning, skin disorders, and social and emotional growth.
Spina bifida is a birth defect that occurs when the spinal cord fails to close properly. It often causes partial paralysis but seldom affects intellectual functioning. These students are typically supported by a para.
The most common neurological impairment in school-age children is convulsive disorders, or epilepsy, which is a tendency to have recurrent seizures. There are two types, absent short lapsus and tonic-clonic.
Epilepsy is the Greek word for seizure disorder. Medically speaking, it's the term used for having had more than one seizure. Children may experience a single seizure, sometimes related to a fever, and still not be epileptic.
They may have a one-time seizure and potentially never have another seizure again. However, if you've had more than one seizure, or if you have a tendency towards having seizures, then at that time that is a seizure disorder.
A seizure can happen anywhere, anytime, and range from a grand mal full-body convulsions to a less dramatic absent or petit mal seizure.
They can have a moment in time where it appears that somebody's not paying attention, but what's happening is that they have a seizure going on in their head. Many times this can happen multiple times a day, sometimes hundreds of times in a day.
The seizure itself doesn't cause brain damage, but how you handle the seizure is important. First off, don't panic. Second, put the person on their side. And third, do not put anything in their mouth.
It has been told that we may swallow our tongues, but that does not happen. However, if you put something in a person's mouth, whether it's a spoon or a finger, you could potentially gag them, and if we do gag, we can have vomit that can go into our lungs.
And finally, contact your doctor for a diagnosis if you or someone you love has a seizure. For Lee Memorial Health System, I'm Amy Osher.
Muscular dystrophy is a chronic disorder characterized by the weakening and wasting of the body's muscles, where people lose their ability to walk and use arms and hands. School personnel need to remember not to lift or pull a student and need to be alert for signs of fatigue.
Those with traumatic brain injury are often characterized by extremely unique educational needs. They often have difficulties with memory, attention, and executive functioning. They also have slowed processing of information and faulty reasoning skills. Services and supports are often needed in cognition, speech and language, social and behavioral skills, and physical functioning.
Medical diagnosis usually provides initial identification. Some things they assess could be activities of daily living, communication, mobility, and transition skills.
Some accommodations for students with physical disabilities may include adaptive seating in classrooms, assistive computer equipment or software, test accommodations, or lab assistance or classroom aids.
Depending on how chronic health conditions are defined, prevalence varies from approximately 0.1% to 44% in the United States. Approximately 475,000 children and adolescents sustain a brain injury every year, with only 26,000 receiving services.
Some ways you can help is to build relationships of acceptance and equality by seeing beyond the disability, learn about the disability and how you can help, prepare to accommodate the individuals, visit at a level that is comfortable for both, and offer them opportunities to contribute.
Some tips to remember when teaching are to talk to individuals with physical disabilities just like you would talk to anyone else, to avoid situations that may embarrass or frighten a person with a physical disability, and to remember that people with physical disabilities can contribute as well as others.
You are the peace in my trouble.